Hello, everyone. We're just waiting for everyone to join. I'm going to give people a couple more minutes. Hope everyone's having a good day. We had um, a lot of people sign up for this, and some people might be signing up for the recording. So it was nice to have you all join. And I think as people arrive, I'll just let them in. So I'll probably get started. Okay. I'm gonna I'm probably gonna have everybody leave their volume off. I'm gonna change the chat preferences so that if you want to chat me, you can just send a chat to me. Yeah. Okay. Well, I anticipate we'll have more joining, but I'm gonna go ahead and get started because we have a lot to cover today. So thank you, everyone who's here and everyone who's going to be watching this on recording for attending this talk today, this webinar. My name is Kim Kaiser, or Kimberly Kaiser, and I'm a practicing sex therapist and trauma therapist for many, many years. And I'm giving this talk on mindfulness because it's so, I think, important for just general well-being and mental health, but also it's integral in sexual functioning. And I'm just trying to figure out how to um, uh, get my picture big. For some reason, Amy, your picture is big. So maybe what I'll do is, I wonder what that does. No. Um, um, hmm. I don't know what that does. Sorry, guys. Um, okay. Somebody's chatting me. Okay, yes, I clicked on view, chose speaker, but for some reason, is everybody just seeing Amy right now? Which isn't a problem, but it would be, you see, okay, good. So you're seeing me in full screen. Okay, great. So that's awesome. All right, great. So I just wanted to make sure that you could see my face. Okay, so sorry about the little technical glitch. Okay, so I am going to start. So this is a program about mindfulness and introduction to mindfulness. So this might be good for, those of you who have never tried mindfulness and those who have tried it, maybe and have it part of your life on an ongoing basis. You still might learn some things. I know as someone that's been studying mindfulness for many years, I always hear something new every time I take another mindfulness training. But specifically, we're going to be focused on not only the mindfulness skills and practices in general, but mindfulness components that are part of sexual functioning, and really how to use mindfulness to enhance sexual functioning, arousal, and response, specifically today through being in the body. So we're gonna talk a little bit about mindfulness of body and I'll give a short, kind of a Dharma talk or a short talk on mindfulness of body, and then I'll talk about mindful sexuality. And so this whole webinar today will really build on itself, and you will get to, I think, come back to it if it's recorded and listen to it again, because there is going to be a lot of information I'm throwing at you at the beginning. So just take it in. And I would say, as we move through the program, if you have questions, feel free to, I would say the best way, because I don't think we're going to have time in this webinar for direct Q&A, we may, but is to email me a question, or you could type a question in the chat and I can respond to you after the call. But I would definitely say, don't be shy about reaching out. So I'm going to go ahead and get started. So what is mindfulness? So this particular mindfulness webinar will be focused on teaching mindfulness, I think, in the clinical sense. In terms of meditation, it won't be, this mindfulness is something that can be practiced in many arenas, and the things that I'm going to be giving you as mindfulness skills and practices are things that I would use as a therapist and that you would use in basic mindfulness practices and meditation. So mindfulness, we're going to start by defining it in 3 ways. So mindfulness first is intentionally living with awareness in the present moment. So that means waking up from automatic behaviors to be present in each moment of our lives. So living with awareness and doing that with intention. Mindfulness, second, is not judging or rejecting the moment. So you will have perhaps feelings or thoughts of wanting to avoid or evaluate, suppress, block the present moment. And when we are mindful in a meditation or any practice, we are just not judging or rejecting, we're just letting it be. The third thing mindfulness is not having attachment. So it's really attending to the experience that you're having in each moment, and you're not clinging to the past or grabbing for the future. You are just there with non-attachment to the present moment. So just to summarize, mindfulness is intentionally living with awareness in the present moment. It's not judging or rejecting the moment, and it's not being attached to that moment. So that is the basic idea behind mindfulness. So what are mindfulness skills? So, and I recognize just through being a teacher of many different experiential psychological concepts and experiences that it's one thing to hear it intellectually, it's quite another to put it into practice, which I think is why today will be useful, because we'll get to learn and then put it into practice. So for now, if this isn't clicking in terms of like, well, how am I supposed to do that? You'll just maybe take it in, see what you can learn, and then see how it feels when we experience it later. So mindfulness skills are specific behaviors that we practice that when we put them together, they make up mindfulness. There is a what and a how. So what we do when we practice mindfulness are 3 things. We observe, we describe, and we participate. So when we observe, we're going to notice body sensations through our senses, our eyes, ears, nose, skin, tongue. We'll notice these sensations. We pay attention on purpose to the present moment. We want to control our attention, so what we're focused on, but not necessarily, we don't want to control what we notice. So we just notice it's there, but we don't try to push it away or cling to it. Another way of saying this, observing, is kind of like wordless watching. So you just watch maybe what thoughts come to mind, sensations in your body, and you just let them slip by like clouds in the sky. You're just observing. And you want to observe both what's on the inside and what's on the outside of yourself. So Many of the examples I'm going to give today are related to sex therapy and sexuality. And so I will use a lot of examples that can apply to physical intimacy, emotional intimacy, but that doesn't mean that this doesn't apply to any, like mindfulness of body is mindfulness of body in any circumstance. So an example of mindful observation with your eyes would be perhaps to notice the eyes, the lips, and the hands of another person. So just mindfully observing. Again, with those core aspects of intentionality, non-judgment, and non-attachment. So the next is describe. And when we describe, we just put words on an experience. When a feeling or a thought arises, we just acknowledge it. For example, if we feel sadness, we just inside ourselves say sadness, sadness, we're just describing. If we feel a sensation, we might say tightening, tightening. We just describe. Same with thoughts. We label what we observe. We just simply put a name on it. So we label a thought as a thought, a feeling as a feeling, and an action as an action. So what we want to do when we describe is separate our interpretations and opinions from the facts. So an example of mindful describing, if we build on what we just, the example I gave with observation, is perhaps when you're observing with the eyes, you notice another person's eyes, lips, hands, and you describe maybe just what you see. Face seems angry, afraid, sad, and maybe you notice and describe the shape, movement, placement of eyebrows, eyes, lips, mouth, cheeks. You just describe what you're seeing and you pay attention to any judgments you have and try to shift to non-judgment. Same with non-attachment. You're just describing objectively. And the last part of kind of what we do to practice mindfulness is to participate. So by participate, we want to be completely in the activity of the moment. We don't want to separate ourselves from what's going on. And this can be mindfulness with everything from cleaning to walking to, pretty much anything you can apply mindfulness. But whatever we're doing, we want to become one with it. We want to go with the flow and we want to respond with a spontaneity. So this is kind of the what we do when we practice mindfulness. We observe, we describe, and we participate. So when we talk about how we do this, so this is the how we practice mindfulness, I'm going to touch on 3 other basic kind of skills about how we practice. The first one, again, is to be non-judgmental. And that is to see, but not evaluate as good or bad. The mind will very quickly assess things as good as bad and generate all kinds of thoughts and feelings about that. But we just want to notice, again, even the types of thoughts and feelings we're having, and we want to accept each moment and not judge it. And that includes acknowledging like your own values, wishes, emotional reactions. Just don't judge them. You can just be there with them. And if you find you're judging, then just notice, okay, I'm judging my judging. So it's non-judgmental. Another kind of how we practice mindfulness is to be of one mind. So it's very easy to be half present, to be somewhere else. You might even find listening to this talk, you're thinking about something else. It's perfectly normal. It's how we're designed. And so you just want to come back again and again and again to the present moment and let go of distractions. You just concentrate your mind. And if you find you're doing 2 things at once, you just want to stop and go back to one thing at a time. So this is being of one mind. So mindfully, one mindfully. The third kind of how we practice mindfulness is as skillfully and effectively as we can. So we want to be kind of mindful of what our goals are. So today, when we do our guided body meditation, you want to be mindful that and kind of aware that, like, I'm kind of going into this with trying to act as skillfully as I can, putting these principles into play, and doing it effectively. And that often happens in situations where it's a situation we don't want to be in, where it's not a situation we think is fair or one that is comfortable. So when you're being mindful of the body, you might feel that it's not comfortable, but you want to, again, try to be skillfully and effective with how you practice your mindfulness. So that was a very brief introduction to kind of what mindfulness is, what are mindfulness skills, and really the what and how to practice mindfulness skills. So I'm going to move on next to mindfulness practices. So people, I think, usually think, oh, mindfulness is maybe sitting in a meditative position and meditating. But meditating is only really one way to practice mindfulness skills. Mindfulness skills can be practiced anytime, anywhere, really while doing anything. And I think just an interesting example from my life, I had twins. They're 8 years old now, but when I was home with them alone, I remember those times they were both crying. And because I had already been a therapist for quite some time and was trained with mindfulness, there were times when it felt completely out of control. I had these two infants crying, and I was by myself using every appendage I had, arms, legs, whatever, to try to calm these babies. And I remember just the total feelings of powerlessness, helplessness, overwhelm, emotions. And I intentionally was practicing mindfulness, just noticing overwhelm, fear, anxiety, powerlessness. And I would just breathe through it. And I could find over a period of time of practicing that I was able to really just be in those moments without so much grasping for things to be different, without so much resistance to really the terror of it all. Yeah, and the girls are doing just fine. So I just want to say mindfulness itself can be practiced anywhere. So the skills that I'm teaching you really can be used in any situation. And the beauty of mindfulness is that you don't need anything but your own person. You just need a breath. You just need to be alive in any situation to be able to call upon these skills. And that's another reason why teaching a webinar on mindfulness and sexuality is so great, because we could start working on sexual functioning in this very neutral and communal context. Yes, and just so you know, if anyone sends me a chat, I'm not responding to be rude. I'm just keeping up with the talk. So I'm getting all your comments. Thank you. Uh, so that being said, so we can practice mindfulness while we're standing. Like I said, I have to get back on track. Mindfulness skills can be practiced anytime. But meditation is one way that we can practice mindfulness and mindfulness skills while we're sitting, standing, or laying quietly. So when we actually decide, okay, we're going to meditate and we're going to apply these skills, we're going to practice these skills, we decide we're going to focus on the mind, body sensations, emotions, thoughts, our breath, or we're going to just open our mind to whatever comes into our awareness. So there are many forms of meditation, and most of them differ by whether we're opening the mind and focusing on just the contents of the mind, or we're focusing on something specific. We're calling on our attention to focus on something specific. So today we are going to do a focused guided meditation on the body. So that is something specific we'll be focusing on in a meditation. Mindfulness also can be used in movement. And because I am a trauma therapist, many times when I'm working with people who have a history of childhood abuse or neglect in any form, and have a lot of chaos, maybe post-traumatic stress, or even been diagnosed with PTSD, they have a very hard time just sitting. And so I would say, if that's you, and you know who you are, you have this experience of, like, you find it very hard to sit and go inside, maybe today you just listen to the talk and you decide to practice later. It's totally up to you. You should trust how you feel. I think it's okay to feel uncomfortable doing mindfulness meditation, but not to the point of total dysregulation. I would say that's when it'd be better to work with a professional, maybe doing some trauma work before. But the other thing I would say is that for those that have a hard time just sitting, or if you find you're really anxious and you want to sit and do some mindfulness work, but you find it hard to just really sustain that, then I would recommend mindfulness movement. And these are things like yoga, martial arts, hiking, walking, all these things you can implement and practice the mindfulness skills while being in movement. And it does the same thing, but it takes the focus off the internal, negative sensations and feelings and thoughts you may be having. So we're going to move on to a section on mindfulness of body. And there's been many, many things written about mindfulness of body. But we're going to do just a kind of a brief introduction to mindfulness of body. And I'll sprinkle in some things about sexual health and sexual functioning in here. And then we'll go into mindful sexuality. So many people are disconnected from their bodies. They critique their bodies. Many people feel uncomfortable or painful sensations in their bodies. Many people think there is something wrong with their bodies. But really, to appreciate the body is to feel the body. You cannot appreciate the body if you're not connected to it. So I'm going to read you a quote from the Buddha. There is one thing that, when cultivated and regularly practiced, leads to deep spiritual intention, to peace, to mindfulness and clear comprehension, to vision and to knowledge, to a happy life here and now, and to the culmination of wisdom and awakening. And what is that one thing? It is mindfulness centered on the body. So this is a quote from the Buddha, and as we go along, you can see in your mindfulness practice how that maybe plays out. I'm planting that seed now for you. So in our culture, it's valued more that we learn through thinking. Really, and this is at the detriment to paying attention to our bodies. Interoception is a scientific term for our ability to sense what is happening in our bodies, to bring attention to what is happening just in our physical body. And because most of our culture kind of promotes a disconnection from the body, like we don't have a class on how to understand your body's wisdom or what's going on in your body, and how this maybe is related to emotions you have, or how to calm the body. Like, these are things people learn, like you, who are coming to trainings much after all formal education. Because of this, practices to be able to feel body sensations in this non-judgmental and accepting way really can allow you to develop a felt sense of the body. The body is always in the present moment. It's the mind that takes us into the past or the future. So using the body and the breath as objects of mindfulness can really ground you in the present moment. But even when we do that, and you may notice this today, we can notice judgments, fear, anxiety, or any array of negative experiences occur just in our noticing the body. But by using mindfulness practice and using mindfulness skills, you can start to connect to sensations of the body and experience a felt sense of your body and yourself. So a felt sense is something that's different than I think more objectively seeing the body. And we're going to go into that distinction as we go along. So there's this general, I think, maybe underlying idea that somehow if something is painful, it's associated with punishment, and something that's pleasurable is associated with a reward or something good happening. There's this kind of polarization in our default. But and really in our culture, we learn that having pain is not the way things are supposed to be. But when we believe that pain is a mistake, and when I say pain, in the context of this talk on mindful sexuality, it could be the symptom of a sexual dysfunction, a negative relationship we have with our sexual body, our sexual sensations. When we learn, or if we believe that these negative experiences of the body or pain is a mistake, when we believe this, we're really at odds with reality. Because being present in the body is to be present with everything, with the discomfort, the illness, limitations, disease. And research has shown that there's a relationship between the types of thoughts you have when you have physical pain. In other words, the more negative thoughts are about pain, the more pain you experience. And the same has been found for sexual distress and sexual dysfunction. So the more in the diagnostic criteria for all the sexual dysfunctions, to meet criteria, you have to have distress about having the symptom. So it's really not what's happening that matters, it's our relationship to it. Your relationship to the sensation, that is what matters. So through this mindfulness practice, we're able to get a felt sense of our body's physical sensations and experience and have an open and accepting relationship with them, even if the experience is painful or things are not working in the way that we want them to work. And we can see and feel the sensations more clearly and the emotions and thoughts that we've attributed to them. And it's really about kind of cracking this apart, breaking this apart, because when you're caught in the kind of a negative feedback loop of, oh no, there's a problem, something's not working, and having negative thoughts about it, negative feelings, we want to kind of restrict our access to our bodies. We want to restrict our experience of that unpleasant experience. But when we do that restricting, then we also restrict our access to pleasure. So this is important. When we restrict and resist aspects of our body, we then lose our access to both pleasure and pain. So that's going to be very important in terms of a mindful practice of body sensations. So when we have a physical illness or symptom, these things can also be the source of a lot of shame, self-doubt, even self-hatred. Most people I work with have a horrible inner critic about their bodies not working in the way that they want them to. And illness can feel very personal. It can feel like it's your fault. Yet every person has, including myself, and probably everyone who's listening to this, has a life, and people that are not listening to this, has a life with both sickness and health. So in mindfulness, we learn to turn compassionately towards the body, no matter what condition it is in. So it's natural, again, to want to suppress or avoid, but really in overcoming blocks to sexual intimacy, when we're trying to suppress and avoid, we're only perpetuating the symptom. And in my experience, I've worked with either myself directly or supervising other therapists, thousands of patients with sexual health concerns. Symptoms often hold meaning. And when you listen, and you really listen mindfully with curiosity, without judgment, there's a lot of wisdom in what they have to offer. So that's another part, I think, of being very mindful with your body. Our relationship with our body, this is another aspect I wanted to cover, can also be one of being experienced through objectification rather than being sensed. So in sex therapy, for a long time, this has been called spectatoring. It's when you kind of become a spectator of your own physical experience. And when the body becomes the source of sexual arousal and response, this experience that's happening in your body also becomes objectified, almost like you see it happening. And when you're not really in it, and you're just kind of seeing it, then you start to evaluate its performance. It can have, negative thoughts, feelings. You evaluate yourself. You have judgments about satisfaction. And this is all taking away from what is the opposite, which is just feeling what is happening. So mindfulness allows us to kind of push those things or gently guide those things together so we can be in the moment, feeling what is happening rather than on the outside looking in. So here's another quote, Hermann Hesse. There is no reality except the one contained within us. That is why so many people live such an unreal life. They take the images outside them for reality and never allow the world within, the body and mind, to reveal itself. So this is really an invitation about the body and the mind to reveal itself, to be present with what's ever there. If you close your eyes and you feel carefully, and we'll try this when we do our exercise, you won't feel a body. Body is just a word, it's an idea, it's a concept. What you'll feel is hardness, softness, pressure, heaviness, texture, coolness, vibrations, stillness. We know our body through color, sound, odor, taste. Everything else is something we've kind of made in our mind. And when we mindfully direct our attention to these physical experiences, we can really start to untangle ourselves from this artificial meaning and identification. Any strategies that we use to control or withdraw from our experience really prevent connecting to the body just as it is. So if we can pause and attend and be connected to what's happening, we just want to stay awake in our body. So just kind of get grounded in that. Just stay awake in your body. Meet each moment, each sensation with acceptance rather than grasping, resisting. And you can slowly come out of that negative perpetuation of this relationship with your body. So when we sit with the body, we can be present to ongoing changes in our experience. So we've talked about this, all the things that come up, and this is pulsing, pressure, heat, light, everything coming in from the senses, both the internal, the external. We can be flooded with emotions that are happening in the moment and thoughts. We can also be flooded with experiences or past worries, and an ongoing commentary, just what's happening right now. So this is not mindfulness, but this is usually, in my experience, what happens with sexual distress and sexual dysfunction. We're taken out of our body, we're kind of spectatoring and flooded with these negative thoughts and feelings. So we label something as pleasant and good. We want to hold on to it. We want more of it. We want that orgasm. We want that, whatever we want. We're pushing for an agenda of something we want. And if something unpleasant happens, like losing an erection or pain, we label this as bad. We don't want that. Let's push it away. Let's avoid it. On the other hand, sometimes if things are just neutral, and we're just kind of hanging out and we start to get distracted, we can then tend to go seeking for higher levels of stimulation and interest in other places. Again, in all these scenarios, we're kind of leaving the present. So when we're mindful with the body, we're just present with all the changing sensations. We let ourselves experience what is happening. So one thing I think is common with everyone that I've worked with is that all individuals with sexual distress, sexual dysfunction, feel like they're stuck. They don't know how to get out of it. They're stuck in a physical state that they don't want. They're stuck in resisting it. They're stuck in observing it from a distance. They're stuck in disconnection. And this aspect of being stuck really isn't how the body works. The reality is that there is a fluidity of sensations in the body. The body is never still. It's always changing. And if we can be present to it and really attend to the sensations, they will flow and change and disappear. So one of the simplest things I start to teach people when I'm teaching mindfulness, if you just like, let's say you're just sitting and you notice you have an itch somewhere on your body. And if you scratch it, then you usually have another itch that shows up somewhere else. But if you just sit with it and breathe with it, then after a period of time, it just kind of goes away. So there's a fluidity with all sensations in the body. So there's nothing static about our experience. It's our resistance to it that keeps us stuck. So if we can just be in the present moment, you'll start to notice, and this is part of why we practice mindfulness, is that you can actually be present and the sensations will flow. So trust your body. Really, I want you to start to learn to just trust your body. So unwanted sensations or experiences, your body not working the way you want it to, don't in and of themselves necessarily result in suffering. Over the years, I've treated many people, maybe they weren't coming in for a specific sexual dysfunction, but their bodies weren't working anymore, just the normal aging process or illness or other things that have happened. And they're like, well, it's okay. I don't need to have penetration to have pleasurable sexual experiences with my partner. There's lots of ways that our attachment to the way things have to be is what creates suffering. And suffering happens when we resist what is occurring and we want it to be different than what it is. So the moment we believe something is wrong, our world will kind of shrink into that suffering. And I've already kind of talked to you about if you do have trauma and you do have significant PTSD, this is a time where just to use that discernment that if it starts to become like numbing, dissociation, kind of freezing, maybe it would be better, or on the other end of the spectrum, going more to like, panic or sweating, or, you can't contain whatever symptoms you're having in the body, then it would be better to, I think, work with a trauma therapist on that before maybe going into a mindfulness practice. But learning about it today won't hurt either way. So, all right, so we've arrived at the section where we're going to talk about mindful sexuality and kind of tie in what we've learned so far about what mindfulness is, what mindfulness practices are, what mindfulness meditation is, and how does that actually work with sexual functioning. So before mindfulness really was brought into the West, I believe in the 90s, John Kabat-Zinn brought it to Boston or Massachusetts, and that was when it really started to come into the US. But in the 1970s, there were some sex researchers in the US, William Masters and Virginia Johnson, that were actually doing mindfulness-based sex therapy interventions to try to help their clients overcome sexual functioning problems. And they were not labeling it as mindfulness, but I still do sensate focus with my clients today, and it's a series of guided exercises where you have the clients focus on whatever it is, if it's a hand caress, face caress, body caress, and focus on what you're experiencing in the moment. Again, those principles of mindfulness in a sexual scenario, a physical intimacy scenario. So research, with mindfulness coming into more of the culture and academic study, there's quite a bit of research on mindfulness and sexual functioning. And it's shown that even a single experience of mindfulness can influence sexual response in women. There's, a lot of research that hasn't been done. Clinically, I've seen similar results in men. I don't know of any research that shows those results in men, but I teach mindfulness to all the individuals I work with. And so starting with basic mindfulness training in this context, a context that's not sexual, ultimately creates this kind of gateway for you moving mindfulness into a sexual situation at your own pace. It's a really nice place to start because there's not very many avenues for really, where do you go to get help with a sexual situation when you're not being sexual with your healthcare provider. So this is like a very nice way to really learn about some basic premises of sexual functioning in an appropriate context. So I want to talk a little bit about what I call this negative feedback loop, and I've referenced that earlier, but there's this sort of internal cognitive and emotional negative feedback loop that happens that maintains sexual dysfunctions and distress. And in sexual distress or dysfunctions, there's when there's an interaction and the emotions and thoughts that occur after a negative physical experience happened, for example, loss of erection or anticipation of pain or inability to orgasm or premature ejaculation or even fear about a sexual situation or negative thoughts about your body. All of a sudden, this being in your body in that situation tend to have emotions like anxiety and negative thoughts that just come up, like this isn't going to work, I'm weak. A whole host of negative thoughts and feelings can happen. And this can shift your attention then away from what's just happening in the body to negative cues. You're kind of priming the system to then focus on negative cues. And negative cues can be anything from perceptions of your partner, negative feelings and reactions, to your own physiological responses. Like we said, you can interpret like a sensation of pain as being more of a sensation of pain than maybe it would for somebody that's not interpreting it that way. And upon feeling these negative cues or sensing negative cues, this then activates the nervous system, which makes you have more negative emotions. And again, you just kind of see this snowball effect or this negative feedback loop where you'll have more distress and more issues with functioning, with more negative feelings about your body or about sex. So I was going to talk a little bit about anxiety and negative thoughts, and I'm just looking at the time. I think I'm going to skip that section for now. I'll summarize it to say, in general, we live in a culture where, the majority of people are educated about sex through pornography or medicine, and also where our culture has a lot of unrealistic expectations about performance, or people are raised, in sex negative religious situations, or often to no ill intent or anything like that. It just, the messages people receive then informs their relationship to their bodies and sexuality in terms of anxiety, secrecy, or sex negative thinking. And research has shown that with all sexual dysfunctions or sexual distress, that they're made worse when someone has higher levels of anxiety. So I would say one of the kind of the bonus features of learning mindfulness of body is that anxiety can occur with thoughts and in the physical body. And when you're working, and because there's such a strong link between anxiety and sexual dysfunctions, when you're using mindfulness principles to manage negative experiences with sexual functioning within your body, and anxiety is a big part of that, learning mindfulness to treat anxiety will extend far beyond what we're doing here. It'll extend to any situation in which you have anxiety, which I think is really helpful. Anxiety is treated with mindfulness is very effective. So, okay, we have just a little bit more, and then we're going to get on to our meditation. So, the components of mindfulness are a part of sexual functioning. So this is kind of where we're going to tie everything together. So, like we discussed, one of those components is attention. So attention is just what it sounds like. It's when you're paying attention to, attending to what's happening in the moment. So research has shown that sexual response is affected by the focus of attention. And when I say sexual response, there's a whole kind of curve that happens where someone might feel desire, and then they feel arousal, and then they work towards a kind of plateau, and then there's orgasm, or orgasm plateau. There's a whole sexual response cycle. And this happens and unfolds naturally in people that don't have issues with sexual dysfunctions or distress. But as we've learned with the negative feedback loop, that problem can get cut off when someone has negative thoughts, negative feelings, negative body sensations. So what we've learned is that sexual response, so sexual arousal and response, is affected by the focus of our attention. So sexual response, and I want to make a distinction for you. Sexual response can occur subjectively. That means through your inner world, what you feel. But sexual response can also occur through your physical body, your genitals, the sensations of being sexually aroused, vaginal lubrication, erection. So again, this idea, sexual response and arousal is subjective. It's a feeling of being turned on, and it's also a physical event. So there's two aspects of sexual response. So there was a really, really interesting study that looked at focus and attention and sexual response. So they had this group of women. And again, when I cite studies that just have males, females, there's hardly any literature on non-binary or transgender. So I present these findings knowing there's a lot of work to be done in the literature, but I think that these play out pretty true to what I see in clinical practice, regardless of gender. So there was a study that had women, these two groups of women, watch an erotic video, and they had them connected to different measures that would measure vaginal lubrication. There's different tools to do this. Subjective measures, they would report how they were turned on. And they told the first group of the cohort A, they told the first group of women, I want you to, when you're watching this erotic video, I want you to focus on the people in the video. So focus your attention on the people in the video, what they're doing, the erotic video. It could have been something pornographic or something educational, but something that would be explicit and probably elicit a sexual response in most people. The second group, they said, we want you to focus not on the people in the video, but we want you to focus and attend to what's happening in your body as you watch the erotic video. So same erotic video, two different conditions. And what these researchers found was that the group that was asked to focus outside themselves on the images in the erotic video had subjective feelings of arousal. So they were emotionally, mentally turned on, but they did not have physiological arousal. Well, meaning they didn't get lubricated or, have a physical response of being sexually aroused. While the other group of women who attended to their own bodies, so they attended to their body, They watched the video and they paid attention. What's happening in my body right now? They reported not only being subjectively or mentally or emotionally turned on, but they reported also, and they did this with objective measures, like they have special tools to measure like vaginal lubrication and arousal response. They also had a physical arousal. And so what we see in this study that I think is fascinating is that where we focus our attention impacts both our subjective and our genital arousal. So it's important to focus on your body sensations. What you attend to, what you focus on in sexual activity can actually increase or decrease how turned on you are emotionally, mentally, and physically. And that, I think, is really the key to mindfulness with sexual functioning. So we apply those principles of attending to with non-judgment, with non-attachment, to the actual sensations that are occurring, and it will actually heighten the level of both subjective and physical sexual response and arousal. So that's really kind of tying all those pieces together. So I think with that, I am going to shift gears into our guided meditation. And I just threw a lot at you and we're already over time. I wanted to do this in 45 minutes. I'm going to keep going. I understand if anybody needs to sign off, this will be available, but I do want to do a guided exercise with you. It'll be about 10 minutes. So I'm going to do a guided exercise, kind of integrating these principles. Yeah, so I'm just going to give a short introduction and then we'll do a brief meditation. So this may be a review for some of you, and for others, this may be the first time you're hearing this. So I'm going to just give you a little bit of information on just basic breathing for a meditation. So when we meditate, many people with anxiety, or when we practice mindfulness, and we turn our attention inward to body and breath, the tendency, I think, especially if you have anxiety, is to do a lot of chest breathing. So you'll be like in the chest. And what that does to the nervous system is it really kind of maintains your anxiety. And what I would invite you to do is to breathe down into your belly, to really breathe in through the nose and breathe all the way down. Into the belly. And one of the easiest ways to know if you're doing this is like to place one hand on the heart, one hand on the belly, and just to see like where the breath goes. And you can play around with this out after this webinar. You can do it at any time. You can do it during this meditation. But I would invite you, while you're doing this guided exercise today, that you really try to breathe all the way down into your belly. I like to take long, deep breaths, and I'll guide you through that as we go. And the other thing I'm going to do today, I'm going to give various scenarios. So the way this webinar was designed is that you can go back and listen to it as many times as you want to, and in different situations than just being here with me. I would encourage you to do this in a variety of contexts, because we're going to be doing a mindfulness of body specifically aimed at noticing perhaps sexual feelings or thoughts. So the purpose of this is not to make you get aroused. I'm a clinical professional. But the purpose of this is to get you to start to notice sensations that may be sexual and how you respond to those, and see if you can stay present in the body. And so I'm going to give you 3 scenarios, and I'd like you to choose what you do today. So the first one would be just to sit with me in this webinar in your chair, your hands on your lap with an upright position. And we're going to do a body scan that just lets you really be in the body, just as it is in this moment. So that's option one. Option two would be either after this webinar is over or during the webinar within your mind to take yourself into a situation where it might be a time where you'd connect with yourself as a sexual being, a sexual body. And that you could picture yourself laying in your bed. You could have like maybe one hand on heart, one hand on belly, one hand on genitals, one hand on heart, just so you're like connected with your body. You could have your hands anywhere you want them. If you're doing this in your mind, you could do it maybe clothes off, you could have clothes on, keep your cameras off if you're doing anything else here. We don't want to do that, but I'm just giving you some ideas for things that you can practice on your own. So this is another way to integrate mindfulness with awareness of, sexual sensations in a sexual body. So the third scenario would be to do it with a partner. And I love doing these exercises with partners because in our kind of penis and vagina driven culture, a lot of partners never do things like I'm going to tell you about right now, which is just to be mindful with a partner. So many times I'll have couples sit back to back. I think that's a really safe thing to do with a partner. You can do it maybe seated on the floor, on the bed. You sit back to back, and what that does, you could sit cross-legged, and you can really feel the person's breathing, heart rate, heat from their body, and feel a connection to a partner. The other thing you can do is sit side by side in a chair, maybe one hand over the other, feel that connection. You could do, hands, maybe hands on each other's hearts. You can do all kinds of configurations with the body that have a physical intimacy connection that may generate feelings of sexual response, but aren't directly going for like sexual engagement. Because the idea is here we're broadening what it means to be in the physical body, experiencing sexuality. So those are the scenarios. There's option A, by yourself with me in this webinar, just a mindfulness of body. Option B would be with yourself in a more connected physical space, lying or seated. And option C would be with a partner, connected in some form. And so I'll let you decide, and you can, if you're watching this afterward, you can literally do it with the person in one of those ways, or with yourself. If you're watching it now, I would ask you to take your mind there and bring your mind there. So that was a very long introduction, and now we will sit. So I am going to do it with you. I will close my eyes and walk you through it. And what I would say is that if you can close your eyes, that would be nice. If that feels like too much, then you can just gently gaze downward or anywhere that feels comfortable for you. There's no perfect way to do it. It's really what works for you. So you can slowly start to close your eyes and bring your attention inward. Start to notice the breath. Just see if you can follow the breath in and out. Just see if you can elongate the breath, meaning that you're taking those deeper belly breaths. And you can notice right away if there's feelings of distraction, if you have anxiety about turning inward, if you feel sleepy. And I want you, as you breathe, really just to make space for all of it. There's no right way. There's, like we said, no judgments, just acceptance. You just want to start observing and describing what's occurring just as we breathe. And we are going to do a body scan, which you may have done before. We're going to integrate a little more attention to sexual sensations and our thoughts and feelings that arise if those things also arise. So I want you to start with the head. Just bring your attention to your head. Really get a sense of the weight of your head on your shoulders. Any sensations coming from any part of your head, just really find it, feel it, focus on it. And just allow it to be. You can notice the back of the head, to the top and around the face. Notice your lips. Relax your jaw. Relax the eyes. And kind of that seat of the thinking mind. Just notice any thoughts arising. And just label it thinking, thinking. And just come back into the moment, just really being present with feeling into sensations in the face, the head. Take your attention down your neck, your shoulders. Continue to breathe. Many people carry tension in their shoulders, their neck. So that's there, just label tension, tension. Just being present. Take your attention down through your chest, your breasts, if you have breasts, or your nipples. Just notice any thoughts or feelings associated with any sensations. Just being fully grounded in the body, in the breath, and just continue to expand the space that you're in. Everything is exactly the way that it's supposed to be. Following your attention down through your back, your shoulder blades, your spine, all the way down the top of your hips. Just being present. And then follow your attention down each arm, starting at the shoulder. As you breathe, just notice sensations in the biceps, the back of the arms, the elbow, the forearms, and wherever your hands are resting, if they're on your heart, your abdomen, your thighs. See if you can feel into the heat. If there's clammy, cold, sweaty, whatever your hands are feeling, just allow it to be. Trust your body. Allow both pleasure and pain. And if one exists without the other, just be present. Just describe it, just the facts. Take your attention to your hips, your abdomen, down through your pelvic floor, your genitals. And just allow yourself to focus on this core part of your sexual experience, your sexual body parts, your reproductive body parts. Just allow yourself to focus on them. Noticing sensations, perhaps blood flow, or if there's disconnection or fear. Just allow it without resistance. Continue to breathe into the experience. Take your attention down through your thighs, your hamstrings, your kneecaps. Notice thoughts that arise in relation to this part of your body. Feel the sensations. Any unpleasant sensations, just allow it to be there. See if it changes. See if you experience that fluidity, the ever-changing presence of our bodies. Down through the kneecaps, the calves, the shins. And find yourself focusing on the ankles and the feet, and feel your feet. If you're seated, just feel the weight of your feet into the ground and that grounded feeling you have. Just allowing yourself to be fully present. Body. And a couple more deep breaths. Continuing to practice non-judgment, one-mindedness, skillful attention, non-attachment. Allowing that full body presence. And you can take a couple more deep breaths. And then slowly, with that sense of embodiment and presence, just allow yourself to come back into this present moment with me. You can open your eyes if you want to stretch. And just notice any shifts. Notice what you created. Just in this introduction to mindful sexuality. Maybe it's just an inquiry. Maybe these are familiar things that you're experiencing. And just know that this is a process. Everyone takes time and practice with this. And so I invite you to continue to listen to this webinar for as long as you'd like, as many times as you like. You'll receive a recording. And you can contact me. All of my contact information is readily available. If you would like to go deeper into this concept of mindfulness and sexual functioning, mindful sexuality, we have more materials on the website. We have a mini course that we created that has lots of more guided meditations, assessment, journaling pages, if you'd like to continue your exploration that way. So thank you so much for being here with me today, and I look forward to seeing you again. Okay, take care.